Hi there and welcome to our channel. My name is Sarah and I'm here today with iHealthBrokers to talk about TRICARE and Medicare. Stay tuned. TRICARE is a government-sponsored health insurance program for uniformed service members and their family, as well as members of the National Guard and Reserves and their family members. It can interact with Medicare in a variety of different ways, and today we're going to focus on exactly what those interactions are. Now, if you have any questions whatsoever, you can reach us here at iHealthBrokers in the comments below, or you can give us a call at iHealthBrokers at 888-410-0344. We are licensed nationwide and there's absolutely no charge for our services, so please feel free to give us a call if you have any questions. And as always, please make sure to like this video. Liking this video will make it more visible to others who are searching for the same types of information. And of course, make sure to subscribe because we do release these videos on a weekly basis. We want to make sure that our clients and our viewers are as informed as possible. All right, so we're going to talk about TRICARE and Medicare. Let's dive in. TRICARE is a health program for uniformed service members, retirees, and their families. It's going to provide pretty comprehensive health coverage, including health plans, prescription drug coverage, and dental plans. Generally speaking, your costs with TRICARE are going to be pretty low, those monthly premiums, cost sharing, etc. Of course, it depends upon who you are and what your plan is. Now, you can find out exactly what your prices are going to be and compare those different plan options on tricare.mil, and I'm going to put the exact link in the description below, so make sure to check it out if you have any questions. Now, since today we're talking about TRICARE and Medicare, first let's talk a little bit about Medicare eligibility. Now, most people are going to age into Medicare upon their 65th birthday, and of course that's taking into consideration your work history. However, some people become eligible for Medicare through disability. So generally speaking, you're going to be automatically enrolled in original Medicare. So there's not much to do. Usually you'll receive your card in the mail upon your 65th birthday, or again, if we're talking about disability, it's going to be your 25th month of receiving disability benefits. Now, if you do have to enroll manually, then you're going to want to make sure to enroll during the 7-month period surrounding your 65th birthday. So this would be the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter. During this time, you're going to want to contact Social Security to enroll in Original Medicare. Original Medicare is comprised of Medicare Part A and Medicare Part B, and together they're going to cover a good portion of your health needs. Medicare really does provide extremely comprehensive coverage. So Medicare Part A is your hospital insurance. It will cover inpatient care in a hospital, skilled nursing facility care, nursing home care, hospice care, and home health care. Then there's Medicare Part B, which is your outpatient insurance. That's probably what you're going to use more on a regular basis. So Medicare Part B will cover clinical research, ambulance services, durable medical equipment like wheelchairs, mental health services, inpatient and outpatient procedures, partial hospitalization, and very, very limited prescription drug coverage. Of course, with Original Medicare, you'll also have access to the Medicare network, which is pretty extensive. Most doctors and hospitals do accept Medicare. Upon becoming eligible for Medicare, you're also going to become eligible for TRICARE for life, which is a little bit different than the TRICARE that you've had in the past. You may notice that your copays, your coinsurance, or your deductibles change, and we're going to go over that in just a second. One thing I do want to let you know, there is no enrollment fee for TRICARE for life. However, you do need to continue to pay for your Medicare Part B monthly premiums. That's determined by your income. We talk about that in another video, which I'm going to put in the description below, so make sure to check it out. So this handy chart on TRICARE.mil really explains how TRICARE and Medicare interacts as far as the cost. I'm going to put a link to this exact webpage in the description below so you don't have to go hunting for it. So let's say the service is something that's covered by TRICARE and Medicare. This is probably a lot of your more basic services. So let's say it's something like a doctor's appointment. Well, Medicare is first going to pay the Medicare authorized amount to the physician. Then TRICARE is going to pay for the remaining amount, leaving you with nothing. Now, if it's a service that's only covered by Medicare, Medicare is still going to pay the Medicare authorized amount to the physician. TRICARE isn't going to pay anything. So at that point, you'll be responsible for paying your Medicare deductible if you haven't already met that, and then your portion of the cost share, which is either in the form of a copay or coinsurance, unless, of course, you've enrolled in some type of Medicare supplement plan that will take care of your copays and coinsurance for you. Then let's say that the service is only covered by TRICARE. Well, Medicare isn't going to pay anything. TRICARE will pay the TRICARE allowable amount, and you will be responsible for the TRICARE deductible if you haven't already met it, and the cost share, which is either coinsurance or copay. And then finally, if the service is not covered by TRICARE or Medicare, well, Medicare isn't going to pay anything, TRICARE isn't going to pay anything, and that means you will be billed charges for the full amount. So once you're enrolled in Medicare and TRICARE for Life, it's actually very easy to receive services. You're not going to receive a separate TRICARE for Life card in the mail. All you have to do is present your original Medicare card, which you should receive in the mail, as well as your military ID. So we've covered your basic health needs, but what about prescription drug coverage and dental and vision? Well, Medicare does not cover these benefits, so let's talk about a couple of your options. Number one, TRICARE for Life does offer prescription drug coverage. So if you're enrolled in TRICARE for Life, there's really no need to enroll in a Medicare Part D plan. The only exception to this is if you're living with limited assets and limited resources, a limited monthly income, then you may be eligible for the Extra Help program with Medicare Part D, which could potentially offer you some type of savings on your prescription drug coverage. Really, other than that, though, your TRICARE for Life benefits are going to be far richer than Medicare Part D. So again, you only really want to look into Medicare Part D if you're living with limited income, limited resources, and you may be eligible for extra help with Medicare Part D. We've got a video about that. I'll put it in the description below. Then there's dental and vision. So original Medicare also does not cover dental and vision benefits. However, you may have an option available to you. If you want to check out benefeds.com, I'm going to put the link in the description below. There are several options for dental and vision programs. Of course, there's also private insurance plans and things like Medicare Advantage. We've got videos about that as well. If you liked today's video, please make sure to click like. Like I said earlier, clicking like makes this video a little bit more visible to others searching for the same type of information. Now, the transition from TRICARE to TRICARE for Life and Medicare can be a little bit confusing, but it really shouldn't be. But still, if you have any questions, you can reach us in the comments below, or you can give us a call here at iHealthBrokers at 888-410-0344. And subscribe to stay up to date on all things Medicare, TRICARE, and health insurance in general. Thank you so much. Have a great day. Bye-bye.